Hello, my name is Bruno Gallo, and I am Section Chief for the Department of Anesthesia at Florida Hospital Celebration. I did my anesthesia training at Emory University in Atlanta, Georgia, and I have been practicing anesthesia for 22 years, and have been at Celebration Hospital since the day it opened. Today we are talking about your anesthesia concerns. What choices in anesthesia are available for my hysterectomy? Well, that depends. If you're having a laparoscopic or a robotic hysterectomy, then your only safe anesthetic option is a general anesthetic. A general anesthetic is one in which you will be totally asleep. That is, you will not have any awareness and you will not feel any sensations. You will be totally out. If you are having an open hysterectomy, which happens with much less frequency, then you can have a general anesthetic or a regional anesthetic like a spinal or epidural. During regional anesthetics, your lower body is made numb to any sensation, and then you are sedated to whatever level of awareness you desire. Most patients prefer general anesthesia and want to be completely out. We always do what's safest for you, given your wishes and medical history. Should my surgery be postponed if I have cold with congestion? That depends and will be best determined by your doctors. Typically, if you don't have a temperature greater than 100 and/or a productive cough, then you will be good to go. However, your anesthesiologist will want to listen to your lungs and review any of your lab work for any indication of a more serious infection. Additional tests may be needed to be done on the day of surgery so that we may provide you with the safest care possible. I woke up from surgeries with extreme nausea and vomiting. What can prevent this? Nausea and vomiting after anesthesia occur about 20% of the time. The good news is that the incidence can be reduced significantly with medications we currently have available, and you will be receiving at least one prior to waking up from anesthesia. The vast majority of patients who receive these medicines prior to surgery will not have nausea and vomiting after surgery. However, if you do experience nausea and vomiting in the recovery room, you may be given additional different medicines to help provide relief. Rest assured, you will not be discharged from the recovery room to home if you are an outpatient or discharged to your inpatient room until your symptoms have been resolved. If you have had prior or previous surgery and a history of nausea and vomiting, please let your anesthesiologist know before surgery so that we can be more aggressive in treating and hopefully preventing these unwanted side effects. I have anxiety thinking about anesthesia. What can help? First, let me say that it is totally normal to be anxious prior to surgery and anesthesia. I have had surgery in the past, and despite my knowing both the surgeon and the anesthesiologist very well, I was anxious as well. It's just the fear of the unknown and having to give up control for a short period of time and trusting people you just met. My best analogy to help you with this is whenever I get on an airplane, I am very anxious. I don't know the pilot, I don't know any of the passengers, and I am trusting everyone around me on this flight so that I can get home safe. And for me, the anxiety doesn't go away until I land and pick up my luggage. It's the same thing with surgery. You are trusting your surgeon, your anesthesia provider, and the OR team to take safe care of you. And if you're like me, the apprehension doesn't go away until you're awake, resting comfortably in the recovery room, and talking with your family. And you will. The good news is that prior to heading to the operating room, you will receive sedation medication that will be given through your IV that will help relax you and most likely provide you with no recall of the events after that moment. How long does general anesthesia stay in my system following my hysterectomy? Most of the medicines you will receive for your anesthetic are short-acting. That is, they are eliminated quickly from your system. I would say that none of the original medicines that you received in the OR are affecting you the next day. However, you are going to be prescribed pain medicines that you may need the days following your surgery, and these medicines can definitely make you feel cloudy or not as alert as you normally would be. Do take your pain medicines as prescribed by your doctor and use them as long as you need them. You probably should have no need for pain medicines for this type of surgery after a week or two, and if you are having severe pain a week or so after surgery, your surgeon should be made aware.